Let me introduce myself. I am a doctor, professor, and nursing educator. I'm trying to cover some important topics for the NCLEX exam. My focus is on safety and priority care for our clients. Today, let's talk about acid base balance. First, I want to let you know that our body continuously produces acid. We need to get rid of that acid to protect our body from going into acidosis. So, these are some of the acids produced by our body. The first one is CO2. The respiratory system blows it off. The kidney excretes urine. And the third one is stomach. The stomach produces acid, which is used during the food digestion or occasionally lost by vomiting. The intestine basically are alkaline. So there are three acids which are produced in our body, and those acids may cause acidosis if we do not get rid of those acids. The acidosis and are two types: the respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. So let's talk about the normal values when our body is not in these conditions, not any of these conditions, then we are maintaining a normal acid base balance, which is the pH is 7.35 to 7.45, CO2 is 35 to 45, and bicarb is 22 to 26. The oxygen is 80 to 100. So when I say pH is 7.35 to 7.45, that's the normal balance our body should be in. If it is above 7.45, then we can go into a alkalosis. Anyone who has a pH level above 7.45 will be in a alkalotic stage. If the pH is below 7.35, this person will be in a acidosis. So it means if the pH goes below 7.35, the pH is in a acidosis stage. So it's a acidosis if it is below 7.35. If it is above 7.45 is alkalosis. CO2 is acid. We just said that. So it means if it is above 45, it means it's going to cause acidosis. If it is below 35, then it will cause alkalosis because we need certain amount of acid. How much acid? Between 35 to 45 to maintain our pH level, which is 7.35 to 7.45. So as I said, we need CO2 level of 35 to 45 to maintain our pH. If this level goes above, it causes acidosis because it's an acid. If this level goes below normal, it may lead to alkalosis. It means that we need certain amount of acid to prevent our body going into alkalosis. The bicarb. Bicarb is actually a base. So if the number goes above 26, it causes alkalosis. If the number goes below 22, it causes acidosis. So we need certain amount of bicarb to prevent our body going into acidosis. So that number is between 22 to 26. If it goes high, it causes alkalosis. If it goes below, it causes acidosis. Let's take an example here. In this example, I have written here, this is an example we are doing right now. The first thing we always, whenever we have to interpret our acid base values, we always check first pH. The first thing you will be checking is pH. What this pH is saying? It's 7.33. So this says that this person is in acidosis. So our final result is, our answer is acidosis. Now if we look at here, we have two type of acidosis. Now we have to find out whether it's a respiratory acidosis or it's a metabolic acidosis. If it involves the lungs, if it involves CO2, then it's going to be respiratory acidosis. But if it is not related to lungs, it's related to bicarb, then it's going to be metabolic acidosis. So look at here what the 48 says. Number 48 says, PCO2 48 says that it is causing the acidosis, right? So it is causing acidosis. Bicarb says it's normal. That's a normal. So it means it's related to lungs. This acidosis is related to this, not this, because this is normal. So these two are equal. So this is a respiratory acidosis, it belongs to lungs, and you can also confirm it by seeing the value of oxygen, which is less than normal. Okay, so I hope you all understood this acid-base balance, but if not, please contact me and I will glad to help you. Thank you so much.